boxers versus brief, right? Is that really a thing?
That is definitely a thing. Why do I say that?
What's up, and welcome to another episode of the KopiBros Show, presented the Chit Podcast Network. Now, today, we had the very interesting chance of talking to Andrologist and Urologist, Dr. Joe Lee.
Well, honestly, I really enjoyed this interview for the fact that there were a lot of myths and like things or perceptions that you used to have regarding like men's health or like our sexual health. The key one was actually the boxers versus brief. Like I honestly thought that was like I was just like, honestly, who really cares? Like, it doesn't really matter probably. But then he said it actually really does matter. Then I was just like, oh wow, like really very informative to know.
I think what really shocked me was the story about the guy with the 90-degree penis. I never knew it's physically possible to have a 90-degree penis.
I was a bit shocked when they told me like a 90-degree bend is literally like a band. Wow, like how do you even try it? I was just like, I was just trying to imagine it in my mind when he was mentioning that story, right?
And very medical take about like fertility, about family planning, and about like a couple trying to conceive . Before we get into our episode, a word from our sponsors. Episode of the Chit Chatter podcast is brought to you by sgwatchhub, Singapore's one-stop platform for all things watches. Whether you are buying, selling, or just obsessed with timepieces, sgwatchhub connects you with trusted sellers, retailers, and collectors, so you can find that perfect piece for your wrist.
But it's not just a marketplace. sgwatchhub also offers a full range of services from repairs, polishing and strap replacements to protective films, watch winders, and authentication services, making sure your watch is always in top shape and 100% authentic. They also work with featured vendors like Goodman Luxury, Singapore's premier watch retailer and the go-to destination for high-end timepieces from Rolex, Audemars Piguet, Patek Philippe, and more.
Beyond luxury retail, Goodman Luxury also specializes in professional watch protection foam installation using high-end WSP premium protective films. And here's the exciting part, Goodman Luxury is giving away a beautiful watch winder worth close to $200 that can hold up to 4 watches through our giveaway in partnership with SG Watch Hub.
Take part, check out our giveaway on our Instagram page today and follow the instructions to enter. A big thank you to SG Watch Hub for sponsoring this episode.
SG Watch Hub, in the world of watches to your fingertips. And now, let's get back into the episode. And welcome to another episode of the KopiBros Show, presented by the Chit Chatter Podcast Network. Now, today, our guest is a senior consultant urologist and andrologist in private practice at Singapore's Mount Elizabeth Novena Hospital and Mount Alvernia Hospital with the Asian Healthcare Specialist Group. He's the current president of the Men's Health Society Singapore and specializes in the management of complex urological disorders, including penile disorders, aging male diseases, prostate conditions, urinary stones, and male infertility. To learn more about his experiences, please join me in welcoming experienced urologist and andrologist, Dr. Joe Lee. Hello, Dr. Joe.
Hello. Hi, guys. Yeah, thanks for having me.
Thank you so much for taking your time out of your busy schedule to record the podcast. What have you been busy with?
Well, lately, a lot of clinical work, busy with seeing patients, doing surgery, and also at the same time involved in education, preparing for talks, and also taking on some students.
Wow, even in private practice, you have to take on students?
Yes, I think even though in private practice, I still maintain pretty strong ties with the National University hospital side. So we are still involved in the teaching. And I do go back to the hospitals to do surgeries with the residents there.
So when you talk about education, is this part of it? Or is like education also include like you do talks and all these other kind of things?
Yeah, so I think a lot of involvement is in the professional education. Sometimes when we do talks, right, it could be for other specialists, either specialists in the same field of urology, means urologists, or specialists who are in other fields, could be gynecology or other things, whereby they are interested in the knowledge that we have to share.
I think I would like to start off with definitions. Maybe could you explain to us what a urologist and andrologist does?
Urologist refers to the specialist who manages the urinary tract system. All right. These will include like kidneys, right, where the urine is made. Then the urine goes down through what we call the ureters to the bladder, whereby they are stored. And when the person is ready, he'll pass urine, right, to the urinary tract, or what we call the urethra. And for the women, these are the key urological organs. For the men, it's a little bit more complex because The urinary tract passes through the male genital. So besides kidney, ureter, bladder, for the male side, there will be the prostate, the penis, and also attached to these organs will be the testicles. Andrology basically refers to urologists who not only look at the general urinary tract, but takes on a special interest in particular with conditions that affects the male organs, like the prostate, problems in the penis, and problems in the testicle that can a lot of time leads to fertility issues.
Oh, so is it quite common that professional is both urologist and andrologist, or like sometimes it's not uncommon for them to like, oh, I'm a urologist, then I'm a separate andrologist like that?
Yeah, the fact is, most urologists they are already very busy with urology work, treating kidney stones, cancers in the bladder, cancers in the kidneys.
Oh, okay.
There is, however, a group of us who have a special interest in dealing with these andrological problems. In general, this could include conditions associated with problems with male function, sexual dysfunction, problems with erections, men with infertility problems, which can be due to various conditions like or large veins like varicocele, prostate. The prostate is actually considered a male sexual organ, and as it gets older, the prostate gets exposed to testosterone, it gets bigger, and then you have men with a lot of urinary problems because of enlarged prostate.
I think today's interview, the questions I sent you were very focused on the andrologist part, which is about male fertility, about planning, family planning and stuff like this. But could you maybe share with our listeners what are some of the common issues that on the urology side, patients come to you for?
I divide my practice into two parts, right? One is the urology practice, whereby patients see us for conditions like urinary stones, kidney stones, urinary stones, bladder stones. They could have problems with urination brought on by dysfunction in the bladder. They could have problems in the prostate that's affecting them. Older men, the concern will be about the prostate cancer. Then there's another one that is more subspecialized, which is the andrological part of it. But we deal with complex erectile dysfunction. A lot of them, they don't respond to the usual straightforward treatment because they have more severe conditions. And we have men who see us for fertility problems, right? The worst being, of course, the men who have zero sperm, but is trying to have a child and trying to see what can be done. And we see a lot of patients with problems of deformities in the penis, right? The penis can be curved, they can have scar, they can have issues like the tight foreskin and all that can affect the male function. So this is how I would divide my practice.
We normally start our podcast interviews by learning about the origins of our guests, and we would like to take it all the way back to the start of your journey. So could you share with our listeners your growing up story and how you actually eventually end up in urology and of course andrology as well?
As I was growing up, right, usually have some friends or classmates who are very sure about what they want to do when they grow up. Like this guy wants to be a pilot, this guy wants to be a doctor, that guy wants to be a lawyer. So I'm one of those who is I like studying. I mean, my results are generally okay, but I'm not very sure what I really want to do, right? When it comes to time to go into university, I wasn't very sure. So I was looking at if you have pretty good results, which specialty do people typically go for? You see, medicine, law, I think there's accountancy, engineering, various different faculty. So I wasn't sure what to do. So I just applied for the various courses. And then I asked my father at the time, right, there's so many things. So what should I do, right? I mean, he gave me a simple word of wisdom, right? He said, as long as it's something that's helping other people, like a medicine, then you can't be too far wrong if you go into that line. I think the medical school accepted me, so I just started doing medical school. And again, when it comes to after finishing a medical school, where it's time to decide what you want to do, whether to be a family doctor or be a specialist. My original plan was just to be a family doctor, have a nice, open my own clinic, run my own practice. But along the way, as I was rotating through the different specialties, I came across this professor in urology who is very inspiring in the way he cares for the patient and go out of the way to treat them. To him, it's very clear cut. He's after a patient's welfare. So got me interested in urology. Then as I spent more time understanding the field, I grew to like the field and decided to be a specialist in this field. One thing I realized is that I like dealing with, in general, patients who are older. Right, in urology, you have a lot of older men with prostate problems. For women, they have the gynecologists who look after them. Right, but for the men, there's this field is not very clearly carved out. So men can be seeing his primary care doctor, can be seeing a urologist, seeing some other different doctors for them. So through my interactions with patients, I feel that there's a need to manage this group of patients better, all right, and decided to spend time practicing andrology.
Typically, you always hear that woman goes to see the gynecologist quite often. But in the past, I don't even know what was the terminology for the equivalent for the males. But only I think much older, then you realize that, oh, it's actually called urology. And it's only when you search on Google, like, oh, I have this, like my urine is painful, then who do I go and see? Then usually that's only when you find out that, oh, there's the urologist that you have to go and check it out. Like, I always hear that it's a myth, right? That people, when they say NUS to become to study medicine, you have to get all A's, and sometimes that's not even enough. You have to like have all A's plus a recommendation letter. I just want to see how true is that, because that's like the general public opinion / myth, you know?
Well, I'm trying to recall because it's more than 20 years, right? Since I entered medical school. It's been a long time. So you don't need to have all A's. I mean, I have a couple of A's and then I have some B's now, right? But at that point in time, to enter medical school, and even now, there will be a period of, they will go through an interview, right? Going through interview and to understand what this person is like and whether he's suitable or for this field. What are his views and expectations in terms of the career, right? So there is the interview process. Letter of recommendation, no. I think in my family, there's no. I mean, we're average middle income family. There's no relatives or no doctors within the family. So I would say that within the family, I'm one of the first to enter medicine. At least our government is very mindful, right, to distribute the students with a good result into different fields, then let them all go into the same field. And if I'm not wrong, in recent years, right, a lot of top students, they actually go into fields like computer science, right? Not just the usual professional fields. I think Singaporeans are practical. I mean, they are look at where are the job opportunities, right? Or where is the growth area, right? So for now, it seems like the tech field, AI, all that seems to be the growth area. And people naturally gravitate towards that. The practice of medicine does have its demands. A lot of times it is not like what people think or imagine it to be. There's a lot of difficult periods, when you're trying to practice properly as a doctor. There are tough times, there are long hours and tough work, and this and then the person has to be prepared for before he enters the field.
So when did you actually eventually decide to leave the government system and then after that start your own private practice?
So I've been in government practice for very long. I would say as a specialist for about 15 years or so. Working in a government practice is actually very meaningful. All right, you treat patients and there are a lot of patients with medical problems that require attention. However, what I realized was in the field that I am interested, which is andrology, it is not getting the adequate attention within the public sector, right? The reason why is conditions that we manage, like problems in the penis, sexual dysfunction, all that, is not exactly given the same priority, and rightly so, right? In a busy hospital that's dealing with patients, a lot of cancer, very late stage kidney diseases, so they have to prioritize, right? However, there is a group of men who are suffering from these problems. So I thought that the private sector would be a good avenue to reach out to manage and grow a practice in andrology. So the other reason was also because in private practice, there is greater flexibility in terms of adopting newer treatment methods. Besides the usual regulatory, sometimes to adopt certain new treatment, in a big institution like the public hospital, it can take a long time. We are talking about years to adopt something that is new, right? Simply because there's a lot of effort put into evaluating, studying something to make sure. In the private sector, we would say that a lot of times a judgment that is based on the evidence available in the science. Patients, let's say they are keen to undergo the treatment, and there's very clear about what is the intention and purpose of what's going to happen. There is a flexibility to proceed and then get the best outcome.
I honestly didn't see this thing from this perspective before, because to me, going private is about like, wow, having your own practice, having a new challenge, or it's about the money.
When it comes to private practice, when there is a greater flexibility, or you can grow your practice. So you are not subjected to the same kind of ceiling that would otherwise exist in a big organization. In the private practice, I think the level of collaboration that I've experienced so far is very strong. Doctors from different specialty are very willing to discuss and help each other out, especially when it comes to challenging cases. Everybody takes a very close interest, not just for the patient's sake, but also because we want to improve and do a better job. So everybody is keen to collaborate to get the best outcome.
So I think the next segment the main segment that I want to ask you about is about family planning and sexual health . So especially I realized that a lot of friends in my vicinity, in my age, they are seeking IVF treatment to conceive . So my first question would be, what do you think couples should do when they first realize that they have problems conceiving?
Yeah, so if you go by the strict WHO classification, say that a couple who is having regular sex, right, they should conceive within a year. But if it goes beyond a year and not able to conceive despite regular sex, that's when they are advised to go for further evaluation. When a couple has problems conceiving, typically there can be three situations. One is a purely women issue. That means a woman has certain conditions that make it hard to get pregnant. Or it can be purely a man's issue. The other category will be a combination of both male and female issue coming together to prevent a successful pregnancy. So at this point in time, evaluation has to be done for both the male and the female. Typically, what will happen is the woman will see a gynecologist, right? The gynecologist will examine her, run off some tests to determine whether there are any female factors of subfertility. At the same time, the gynecologist may assess the man, or the man may decide to go and see a urologist or andrologist for the man's part of the care.
So in Singapore, there's no clinic that you can go to, right, that they can check both male and female at the same time. Is there such a thing?
No, there are. So, for example, one of the center where I practice, right, we have both andrologists and gynecologists within the same clinic. So when the couple comes, the gynecologist will see the woman, and then they will ask the man to see the andrologist.
For you, what would you say are some of the common misconception people have about like male sexual health?
I think one of the things that male sexual health has been misunderstood. The male sexual health happen if the man has done something wrong. That's why it ends up with this problem, which is not true. I mean, there's problems of sexually transmitted disease that comes with exposure, but some of other conditions can be congenital, means they can be born with a certain issue that wasn't identified until later on when they become sexually active. Right?
I see.
Or they may have a change in the function of their organs as a result of other conditions that's affecting them. So these are what we call the men with real medical issues.
Do you see like more and more younger patients coming to you like in their 30s or even like below 30s because of fertility issues?
Yes, that for sure. Because well, when it comes to andrology, we see men actually across a whole spectrum of age. The younger patients, they commonly present with a few problems. One will be fertility issues. Some may present with deformities in the penis. Sometimes it's congenital. Sometimes it's something that's acquired or developed at a later stage. And problems like sexual dysfunction is not strictly just an older man's problem. We do see younger men, some as young as in their early 20s, having an issue. and when we manage these patients and we start to do the tests and investigations, we may then pick up conditions that may have been affecting them for a long time and eventually leading to an early development of these sexual dysfunction. They could be born with some genetic disorder, predispose them to hormonal problems. This long-standing hormonal problem led to an early development of sexual dysfunction in a fairly young man.
Luckily, now we would like to deep dive into the male infertility, right? What are some of the common causes? I believe a lot of us are wondering, and like, is there anything we can do to maintain a healthy sexual health?
I think when it comes to sexual health, right, it's actually related to general health, right? So in order to be healthy, I think lifestyle is very important, right? So someone who has bad habits, like always smoking, heavy drinking, in time to come, they're going to have complications that will eventually lead to problems with sexual health, lack of rest, lack of exercise, obesity, right, can lead to hormonal problems that again may lead to the development of sexual health. And of course, there's always this group whereby born with certain problems. Means that these are congenital causes, then they start to manifest as they enter into adulthood.
Most of us are under the misconception that, they always say don't watch pornography, or like let's say if you do masturbate if you do too much when you're younger, it may affect you in the future. Is that true?
Well, I think the question is whether excessive masturbation can lead to a long-term problems. It really depends on the definition of excessive, right? Is it like once a day, multiple times a day, consecutively? So right now, within the at least sexual health world, we have not really come to a very conclusive definition of what is considered excessive. Right? But if the person is having or doing masturbation so often that it affects his general daily function, then obviously it is too much. But the problem with pornography is overexposure to pornography, because in real life, right, not everybody looks like a porn star, right? So if a person is very used to a certain set of stimulus, means they must see something in order to get aroused, right? They may set the threshold high. So in real life, when they see their actual sexual partner, right, who does not have the attributes of what they see in the pornography, then they may have problems in terms of achieving the sexual function like erection, arousal.
How will you treat a mental issue? But physically we can exercise, but mental wise, what can we do? Like
for men to get good erections, for example, there has to be adequate arousal. And arousal, part of it is actually psychological, right? It could be the environment. Does he feel comfortable or safe in the environment, or does he feel stressed? Then, of course, there can be the problems with the organ, the actual sexual organ. A lot of times they are intertwined or even coexist. So, for example, if let's say a man, he has difficulty achieving erection, the next time he finds himself in a situation whereby he's expected to perform, he'll start to feel stressed. He'll start to wonder, am I going to be able to get good erection this time round? It is indeed difficult to tease things at times. We do have tests. Some of these tests that we do in the clinic, for example, like a Regiscan test that we do in my clinic, right, will be a device that is actually applied onto the penis, and then the person is subjected to some sexual stimulation, and then we start to measure the degree of hardness or rigidity that can be achieved, diagnose whether he has a purely psychological or what you call a psychogenic form of sexual dysfunction, or whether there's a real organic form, just by measuring the degree of erection he can achieve. If a man has, for example, anxiety or depression, right, due to what is happening to him in his life, that's affecting his sexual function, then certainly it will make sense to collaborate with a psychiatrist to deal with what is causing the anxiety, what is causing the depression. Does counseling alone work? Or does he need to be on this medication to treat him for his these psychiatric issues? So what I notice in my practice, the organic or medical issue forms the majority of it. But for men who has been suffering from sexual disorder for a long period of time, they would have developed some degree of anxiety, or relationship with their partner could be bad. There could be unhappiness or depression. It starts with how to break the vicious cycle, which is to try our best to help the patient regain his function. So once function is back, right, there is a greater confidence then we can start to deal with the rest of these psychological issues that may have developed over time.
Since you're on this topic, right, can we invite Dr. Lee to share more about like maybe 1 or 2 memorable cases that you have treated?
I've seen quite a number of cases that come across as being not the general or the norm, right? So I remember there was this couple who came to see me. The initial complaint that they have was that the man was having problems with erections.
Okay.
Right? They said that the couple just got married. When they tried to have intercourse, they try very hard, but eventually the penis will soften, and then before they achieve any form of penetrative intercourse. Then on further understanding of what is happening, I realized that this man is able to have very strong erections during his own private time masturbation.
Oh.
Right? It's just that during intercourse with his new wife, he is having issues. And then on further questioning, then we discovered that he could be having a deformity in the penis. In this case, the penis was very curved. So it's not a straight penis. It's a penis that's curved 90 degrees downwards. All right. And the couple, they didn't know that this was an issue. Yeah, correct.
Wow.
So when they were trying to have sex, obviously it's difficult, right, to penetrate a female with a penis that's so deformed. We came to realize this because we asked the patient to maybe share a picture of himself, of the penis at different angles in his full erection, simply by hearing what is happening. Like the wife will say that when they do try penetration, it takes a long time, it's very painful, and eventually they gave up. So all this will give us clues as to what could be going on. So eventually, we did surgery to correct this curve, to straighten out the penis, and they're able to then go on to consummate marriage and then have a regular sex life. Right. So this tells us that it is not always erectile dysfunction or what patient tell you or think is the problem. Sometimes we have to dive a little bit deeper to uncover what's wrong.
This 90-degree penis thing, is it how do you say? Is it a deformity or is it what causes it?
So there are various reasons why deformity in the penis can happen. Number one, it could be what we call congenital, means they are born with this abnormal curve, or it can be acquired, means that it used to be straight, but at some point in time there was some injury to the penis that causes excessive scarring. And when the scar forms, the scar contracts. When it contracts in one direction, you pull the penis down into an awkward configuration.
I always hear that it's normal to be slightly curved. How bad will you say then it will cause an issue, like the angle, or is there a way to check?
So number one is a function, right? When the person is trying to have sex with the penis erected, whether he has any difficulty. I think that will be a very good way to gauge. Then of course, when we do look at the degree of angulation, in general, we know that a degree that's very mild, let's say 15 degrees curve, is unlikely to cause any problem. In fact, if a patient sees us with a 15-degree curve, we'll say maybe just leave it alone, all right, if it's not affecting function. And we know that, let's say from 30 degrees onwards, it will usually start to give problems. Some are manageable, but some are not. By about 60 degrees and above, I think sex is going to be quite difficult. By 90 degrees, I think sex is usually impossible.
I want to talk a bit about the society perception about like sex and sexual health. So do you think that societal attitudes around male reproductive health is improving?
I would say that in the recent years, right, I do see couples being more and more proactive in terms of seeking help. In fact, I do see patients that they could have only started trying for a very short period of time, maybe just a few months, and they want to come for early check to ensure that they are okay before they continue rather than waste time. So in case there's something wrong, they want it corrected early rather than late. So I would think that the overall society seems to be more educated and more willing and more proactive in terms of trying to achieve fertility. There's still a stigma, there's still a taboo. A lot of men don't feel comfortable talking about it. Past a few years, right, there's been a lot of education on the male sexual health. So this actually empowers the men to understand or to identify when he's having a real issue that requires medical attention, and then step forward for help.
What are some of the common causes, or what are some of the examples they can share with us about some sexual health, but to deal with maybe men that are more senior of age?
We'll be looking at men with a more severe erectile dysfunction. Sometimes it's because of age. All right. The male hormone levels could be low for long periods of time. The integrity of the male sexual organ, the penis, could have undergone some degree of degeneration. Or the older man could have other medical problems, diabetes. All right. They can affect the nerves, narrow blood vessels, which affects the blood flow to the penis, which is essential for a good erection. Sometimes their erectile dysfunction are more severe, such that taking just a tablet to try to improve the erection doesn't really work. In this scenario, we'll have to look at other forms of treating them, including giving injections to the penis, strong injections to stimulate increase the blood flow. Includes using energy devices like what we call a shockwave therapy to stimulate the development of new blood vessels, to using mechanical devices like a vacuum erection devices. And for the most severe of erectile dysfunction, we will treat them with surgery, inserting what we call penile implant or penile prostheses to help them regain the ability to have a hard penis enough for sexual intercourse. So in this day and age, right, if a man really is keen to regain sexual function, there's a lot that can be done, from the mild to the moderate all the way to the severe. It's really just depends on how far the man wants to go to regain his function.
Let's say after all the checks, you ascertain that yes, the problem lies with the man, right? Do you suggest that the couple go through this kind of fertility issues as a couple, or would you rather, like, I think men like just go to and see the doctor alone?
Okay, well, I always prefer if they come as a couple. Fertility is actually a journey a couple goes through together. So it is our preference to see them come together. So right at the start of the journey, the communication is very clear, because there are situations in real life whereby couples, sometimes the relationship really falls apart because of the failure to have a child, right? One blames the other, and then the other feels bad, and there's a lot of conflicts can happen, right? So during the consultation, depending on what the findings, all right, you'll be very clear cut. We'll be explaining to a couple what is the likely problem, and what are different solutions, and what each party how they can contribute in order to eventually achieve pregnancy.
My last question will be, what is one thing you wish people knew about their reproductive or sexual health?
Well, I think the most important is for individuals to realize that they are not alone, all right? Because usually, sometimes when a man discovers he has fertility issues, like his sperm test is abnormal, he gets a shock. But the reality is that close to almost 20% of couples may be facing some problems of fertility. Knowing that they are not alone, all right, that there are others with this who face the same issue, we encourage them to then step out and look for a solution.
I just one question that I've been wanting to ask since just now, right? Because I have this one colleague that always says that once you turn 40, your testosterone drop by a huge amount, and that's the reason why you see there's more gays in you have more gay tendencies above 40 years old. I always just don't know whether to believe this or not. So I just wanted to ask, is it true?
Yeah, so I have to say that that's probably a myth, right? So it is not true that the person develop a gay or homosexual tendencies because of a drop in the testosterone. A drop in the testosterone is a very important male hormone. It governs the male libido, his interest in sex. All right, his sexual well-being, the quality of his erections. It also governs other aspects of health, right? Whether he has strong bones, whether he's energetic or he's tired all the time, whether he's strong, whether he has good muscle mass. All right, so it governs a very wide spectrum of function. For men who are, let's say, gay, right? I think the studies have not shown that they have low testosterone. In fact, they could be having very good or very normal testosterone.
That clears the myth. Thank you so much. We would like to end this interview with a round of quick fire questions. What is one thing that men thinks that boosts testosterone but doesn't?
Well, I have patients who have been found to have low testosterone, and they'll say, will it help if they take a lot of red meat, take beef, take mutton, take oysters? Well, the reality is testosterone being low is a reflection of the function in the testes, and may not really be a reflection of the dietary lack of certain dietary nutrients.
Oh, wow. So what is something that some people can do to boost the testosterone? Or they must take medication?
Depending on what is the reason, all right. So of course, there are some patients who can benefit from taking certain supplements which contain substrates that the body can use to make testosterone. There are some who may require a certain medication to stimulate them to increase the production of testosterone, and there may be some who are not able to make their own testosterone anymore, no matter how hard they try. And these patients will require a testosterone replacement therapy.
Okay, the next question I have, right, is BOXERS versus BRIEFS, right? Is that really a thing?
That is definitely a thing. Why do I say that?
Oh, wow.
So you look at it this way, right? All our key organs are inside our body, right? Your liver, your kidneys, your intestine, everything is inside. Why is the testicle something important just dangling outside? Right? The reason why it's outside is because this sperm production requires a temperature that is lower than our core body temperature. That's why it has to dangle outside to achieve this lower temperature. So you wear different types of underwear. So boxers are very loose. So it doesn't really change the natural position of the testes. Briefs, especially tight briefs, right? They actually press the testes higher up towards the body core. Now, if that is enough to increase the temperature, right, then it may have a impact on the sperm production.
Oh, so this means that BOXERS is more preferred?
More preferred.
Okay, so
preferred.
for men who are trying or wanting to have a child, it'll be beneficial if they wear BOXERS instead of brief. But does that mean that brief is bad for every man? Of course not, right? Some men, the problem of wearing brief does not really affect them. Right? So there are a group of men who do perfectly well with briefs.
Wow, that's really something new that I just learned. Okay, the next thing is weirdest questions you've been asked as an andrologist.
When you're an andrologist, right, no question is really weird. But I've got patients who ask, right? For example, they hear about this thing called penile fracture, asking is it possible for us to break or fracture the penis during sex? So the answer is actually yes. Because when the penis is fully erected, it's actually very hard. So it's almost like a bone. So if there's a abnormal force or impact at that point in time, it can lead to a tear in the covering of the penis or lead to what we call a penile fracture.
That's the reason why I always have the misconception that because it's almost impossible to fracture your penis because there's no bone within your penis, you know. So you always watch it in show, but you always think it's just not true.
No, it does happen. So you sometimes in the middle of the night at the emergency department, you can have a man coming in, penis fractured, bruised, and in a lot of pain.
So let's say if it happens, let's say if it's you're at home, will it help that you ice it straight away?
No. So if there's a true penile fracture, the best thing is to go to the hospital and then get the doctors to do a surgery to fix the fractured penis to prevent long-term problems like erectile dysfunction.
The last question will be most common health mistake men make in their 30s.
I would say that the very common mistake is that the men in their 30s, generally they are close to their prime. So they feel invincible. So it is at those times that sometimes bad lifestyle choices like lack of like smoking, heavy drinking, lack of exercise, or that eventually can affect them. and they'll start to see the impact of this regarding care for health, usually from their 40s onwards. So I think this is a very important. We got to take care of health at all ages, even when one is quite young.
We have learned a lot from you today, Dr. Lee. And of course, you're a very busy person. But to close off the episode, can you let our audience know where they can find you?
They can find me on the social handles under Dr. Jolly Urology on TikTok and Instagram.
Thank you so much for your time, Dr. Lee, and all the best for your future events.